Hi, welcome to another episode of Youth Diary. Skeletal system is the supportive system for the body. It gives shape and mobility to our body. And to talk more about it, we have Dr. Raj Mohan with us. He is an orthopedic and reconstructive surgeon at Renai Medicity Hospital. Hello doctor, welcome to our show. Doctor, can you just explain what is a reconstructive surgery of joint?
Joint normally means that the place where two bones meet. The ends of the bones which are meeting are covered with a smooth surface called cartilage, and that gives a smooth gliding movement of the joint. But in degeneration, this smooth articular cartilage is lost, and in that place you get a roughened bone. So when the joint moves, these roughened bones rub against each other and causes pain. So in such severe conditions, it cannot be cured with just medicines, and we may need a joint reconstruction surgery. In joint reconstruction surgery, we remove that damaged layer from both sides of the bone, and in that place we put an artificial layer. And then the movement occurs between the smooth artificial layers and the pain disappears. This is what is briefly described as a joint reconstruction or joint replacement surgery.
What is the incidence of a degenerative disease of joints in our society?
Yeah, joint degenerative disease mainly type like mild, moderate and severe. Mild occurs in almost 80% of the patients above the age of 35 years. And moderate and severe depends on their obesity, their nature of job. And mostly it's mild disease that occurs in 80% of the cases. Joints commonly involved in the joint degenerative disease in our body are those joints which are more actively involved in our day-to-day activities. For example, the neck or the cervical spine. It's mostly involved in people who are working in the computers. So that can lead to a degeneration of the cervical spine called cervical spondylosis. And then comes the lumbar spine or the back. Again, it is mostly involved in people involved in sedentary jobs who sit for long hours in faulty postures.
Like drivers?
Yeah, like drivers and even clerks and those who are doing the sitting job. They don't maintain a proper posture. That can lead to degeneration of the back. Then comes the knees. It's again seen in people who are obese, overweight, and those who have to walk along, who have to walk more staircase. More stress to the knee causes the osteoarthritis of the knees. So most commonly it's the neck, back and the knees.
Okay. So what are the symptoms of this joint degeneration, doctor?
Again, it depends on the joint involved, but initial stage you get pain only in the extremes of the movement of the particular joint. For example, if the cervical spine is involved, you notice when you have to turn for doing a reverse or when you look up, you'll get some pain. That is the initial starting stage. But as the disease progresses, the pain will be there even during rest, and it can come down your arms. And again, the back also. Initially, the pain will be there only when you stoop down, bend down, and all. And later, when it is severe, it will be persistent. The knee also, the knee degeneration, the pain you get initially only while getting up from the sitting position or when you climb stairs or climb downstairs. Initially, these are the symptoms, early symptoms.
Doctor, along with this pain, will there be any inflammation or edema or swelling of the joints?
As I mentioned, when the rough bones rub against each other, it's the body's reaction to produce fluid around the joint, which we call as effusion. So when damaged joints move, you get a fluid collection around the joint. It's called effusion.
Okay, we'll see the next question, doctor.
Hi, I'm Manish. What are the work-related risk factors in causing joint damages?
The work-related risk factors, again, mainly it is related to what is called as ergonomics. That is, especially in the modern kind of jobs. Now, a lot of stress is being given to these ergonomics. That means you have to maintain a proper posture while working, especially when people work in front of the systems for long hours. You have to maintain a proper posture, and the neck has to be steady, and the monitor has to be at the level of the eye. And if you don't listen to these ergonomics, then it can spoil your joint. And another thing is that when those who are involved in sedentary jobs, they tend to put on more weight because their lack of exercise, and the overweight can lead to lumbar spondylosis, the pain in the back that can damage the knee joints in long course. So these are the normal work-related stress related risk factors seen in jobs.
How can we prevent these things? Like, is there any preventive measures?
Yeah, again it comes to a proper posture, as I mentioned earlier. You have to maintain a proper posture, and regular exercise is another, because what was said and done, these jobs have to be done, and in between the jobs, now these offices, they have, I heard that they have gym facilities, etc. And you have to exercise those muscles which are commonly under stress. For example, if somebody is using computer, they have to do more exercise for the neck muscles. If somebody is sitting for a long time, they have to do more exercise for the back. And again for the knee muscles. If you can strengthen the muscles around the damaged joints, that rubbing will reduce, and gradually the pain we can maintain control with this exercise and muscle strengthening.
Doctor, one more doubt here. Nowadays everybody goes to gym, especially the youth. What about this vigorous exercise? Will it adversely affect the joints?
Yeah, definitely. Doing gym is definitely a good thing, but if it is under a proper guidance of a good trainer. But if people go without proper training and they overuse, a lot of damage can occur in the muscles, tendons, as well as the joints. For example, suppose some person is taking a huge weight and doing this exercise for the deltoid repeatedly and on every day. Normally, one muscle is stressed, worked for one day, then it has to be given rest for at least 3 days minimum. Then only it has to be repeated again. But some people do vigorous exercise, some particular muscles like the biceps, so as to build up the muscle. But it's more harm, it causes more harm than good, because when it is overstressed, the tendon, that is the portion of the muscle which attached to the joint, can break. It's sometimes called supraspinous tendon rupture. Now it's happening not very rarely. So suppose it happens, then we may have to do a surgery or an operation to repair the tendon. And muscle can damage, it is overworked. A lot of toxins accumulate inside the muscles, and in due course the muscle can damage. And when it comes to joints, again more load is, some people take a lot of weight and do sit-ups. So that puts some extra, more than 10 times load onto the knees. And if it is done on an everyday basis for a long time, that can damage the smooth articular cartilage of the joint, and it causes more damage than good.
So Doctor, one more doubt here. When we use a treadmill or using an open ground for running, which one is more beneficial or which one is useful?
Yeah, definitely open ground is definitely better, because whatever said and done, the treadmill is made on a platform, and when we run on that platform, there can be small vibrations, and which causes some forces which can be transmitted up the bone and cause some damage in the long run to the knee. But it's not always practical to go and run in the ground because of it's rain and a busy schedule. But you can use a treadmill, but if you have to take some precautions. For example, you have to use a proper footwear, shoe, so that it can absorb whatever stress is caused. And don't use a high speed, because it causes more vibration. Moderate speed and do more time, take more time rather than high speed and small time.
Doctor, what are the symptoms of joint degeneration, or when to meet a doctor?
The predominant symptom is definitely pain, and initially it occurs only during more activities like climbing stairs or turning around and pain. Then there will be some stiffness. For example, if the knee joint is involved, there will be some difficulty in moving the joint to full range. For example, he cannot squat. When he tries to squat, it will cause pain. So pain, stiffness, and sometimes there will be some swelling also. As I earlier mentioned, the bones rub against each other, some fluid will collect in the joint. This pain, swelling and stiffness, if it persists for more than 1 week, then the patient should definitely go and see a doctor to rule out any joint damage.
Okay. So how to diagnose such cases, doctor?
Initially, after the clinical examination, that is by seeing the joint and palpating and feeling the joint, when X-ray is usually needed. After seeing the X-ray, you can see whether there is any degeneration of the bone. And in some cases, you may need some blood investigations to rule out some infection or some arthritic problem like rheumatoid arthritis, etc. We have to rule out by taking some blood investigations. By this preliminary clinical examination, X-ray and some basic blood investigation, you can detect what's happening in the particular joint.
Okay. And in such cases, how will you proceed, doctor?
Again, it depends on the stage of the disease. As I mentioned, it can be mild or moderate or severe. In mild cases, we can do some simple measures like medicines to reduce the pain, swelling and stiffness. And physiotherapy is very useful in the early stages of the disease, where we do some physical measures to control the pain, to strengthen the muscles, reduce the inflammation. And some exercises will be taught, and which the patient has to continue at home. And most of the cases, if the patient continues to do the exercises there will be no problem. But what happens is after the pain subsides, the patient will not do the exercise, then it will again aggravate and it causes more trouble. So then comes the moderate cases, which is in between cases. That is not mild but not severe enough for a joint replacement. In those cases, sometimes what we do is a keyhole surgery, an arthroscopy to remove the damaged cartilage, debris, and actually it's something called the cleaning up of the joint, and it gives good relief in most of the cases if done properly and in reasonably early time. And then comes the severe form, that is the joint is totally damaged, that smooth articular cartilage is lost completely, then we have to do a joint replacement surgery.
You talked about mild, moderate and severe cases. Is there any difference in symptoms in these cases?
Yeah, in mild cases, as I mentioned earlier, you get the symptoms only while you do more stressful activities or you do something which you normally do not do, like when you try to squat, when you try to sit cross-legged, or when you look up for a long time. These are the symptoms in the mild cases. In moderate cases, you get symptoms even while doing normal activities. If you sit for 10 minutes, 15 minutes, you may get neck pain. If you walk for some 5 minutes, you get knee pain. Then it is moderate. In severe form, you will get pain even while resting. Even when you sleep, you tend to wake up in between due to pain. That is a very severe case.
Doctor, can you just explain more about arthroscopy?
Yeah, arthroscopy is commonly called as the keyhole surgery. It's like viewing into a room through a keyhole. We make actually 2 holes. For example, if it is doing an arthroscopy in the knee joint, which is the most commonly involved joint, we make 2 holes, and through one hole we put a small cannula, and at the end the camera will be attached, and through the small camera, you can see the whole of the joint. And through the other keyhole, there are 2 holes. Through the other hole, you put your working instrument. Through the instrument, you do the surgery. Sometimes the articular cartilage, that is the smooth surface at the end of the bone, it can be broken in only some selected places. Those can be smoothed out. It can be reshapen and made more smooth. If it is totally damaged, arthroscopy cannot cure the disease. But if it is in patchy, only in small areas, then we can smoothen those surface. And sometimes what is called, we get the joint debris, that is the degenerated material which can be collected inside the joint, which causes the fluid accumulation. And those debris can be removed. And in between the joint, there is this cartilage surface called meniscus. It's like a shock absorber between the 2 bones. And that meniscus can sometimes, in degeneration, that is also frayed up and torn sometimes. That is what we call as a degenerative tear. That frayed meniscus can also be trimmed and shapen. And somewhat normal anatomy can be recreated in early stages, which gives a long-lasting pain relief in most of the cases, provided the proper post-operative physiotherapy is continued by the patient.
Okay. And after this arthroscopy, how many days the patient has to stay in the hospital?
Normally, it's in Western countries, it is usually done as a daycare surgery. That is, patient gets admitted in the morning, gets the surgery, and he goes in the evening. But in our country, it's we normally admit the patient the previous day, do the surgery, and the next day the patient leaves.
We have heard about the sports person like getting injured like after sports or something. Like, will they be able to regain their sports activity after this arthroscopic surgery?
Sure. Arthroscopy is mainly meant for young people with who get sports injuries. Mostly, it's what happens is in the sports injuries. There are some structures called ligaments which connect the 2 bones. These structures hold the bones together. In severe sporting activities, sometimes like in football tackling, this ligament gets torn. So the knee will be dangling without the connecting structure holding the 2 bones together. So that structure can be repaired through the keyhole surgery, and that structure can be recreated. And after 3 months, normally that structure will work as the ligament. The patient can start playing again, normally after 3 to 4 months of rest.
Okay, doctor, we'll go to the question.
Ma'am, my name is Ratika. I have one doubt regarding the lifestyle modifications that reduces this joint pain.
Yeah, these lifestyle modifications, that includes almost all the activities which we do in day-to-day life. For example, when we sleep, we must use a very thin pillow or no pillow at all. Because if you use a very thick pillow, your neck will be bent like this, and if it is remaining for 8 hours during the whole sleep, it can gradually cause pain and trouble for your neck. So as far as possible, you use a very thin pillow. And never watch TV while lying down. If at all you are watching TV, you sit up in a proper erect position, keep the neck steady, and don't watch with a pillow under your neck and all. These are small things which you have to see. And when you bend, normally what people do is they keep the knee straight and bend straight away. So if you do such a sudden bending, it causes extra stress to the lumbosacral joint. That is why the spine and the hip joint. So whenever you try a bend, take something from the ground, you bend your knees as well. So half the load is taken by the knees and half by the back. So this is another important posture which you have to maintain. And at work, when you sit, again you have to keep your back should be touching the table, or you can put some pillow. Back should always be resting against the chair. And the chair has to be put close to the table so that you can sit erect without bending forwards or leaning down. And if you are working with a system, again as I mentioned earlier, the computer screen should be at the level of your eyes. You should not be turning to one side and working for the whole day. Your neck should always be relaxed and straight. And again, another lifestyle modification means you should have a regular habit of doing exercises, especially to the joint which is more involved in your profession. Like if it is a computer job, you do more exercise to your neck and back. And if your job involves walking for long hours and traveling, then you do more exercise to the knees. Another thing is that people think that climbing up the stairs is a good exercise. It's good for the heart and lungs, etc. But it is bad for the knees, because every time you put one step, it puts some extra stress to your knee, some 8 times extra load to the knee. So 1 or 2 stairs you can climb, but long, maybe more flights of stairs, it is better to use the lift. You can walk in the level ground for a long time, but climbing stairs repeatedly and every day is not good for your knees. So these are the common simple lifestyle modifications which you have to observe in your day-to-day activities.
So Doctor, it was really informative. Thank you so much.
Thank you.
So guys, write your suggestion to us. Our email ID is youthdiaryrosebowl@gmail.com. So see you next week.